Hi, it's Beth Johnson from Umbrella, and today I'm joined with Jeneen Thomsen from the Southampton Hospital's Charity. And Jeneen has joined me today because I'm not sure if any of you have seen my previous post about marketing during a time of crisis, but I had received a letter from the John Radcliffe in Oxford. And since then, I've received a letter from the Southampton Hospital's Charity about what they're going through. So it kind of made me think, what can I do? What can the people I work with do? And so I reached out to them, and Jeneen and I have had some great conversations, and I just thought I wanted to share some of the things we were talking about. So Jeneen, thank you for joining. And do you want to give me an intro about yourself and about the charity?
Yeah, sure. So I'm the current interim director at Southampton Hospital Charity, and we raise money to enhance the care and services at Southampton Hospital. And previously, I've worked in the charity sector now for goodness how long, but sort of worked my way through sort of different elements of fundraising all the way through to where I am now. So we've got quite a good breadth of experience, both with myself and within the team, which has actually been really, really fortunate considering the situation we're in at the moment, because we're all pulling together very quickly and very urgently to meet the needs at the hospital. So as a hospital charity, we raise just under £5 million a year for the hospital, and this is really, as I mentioned before, to enhance the care and service there. So it's really all the added extras. So it's things that the NHS don't have funding to provide. So some people call it like the cherry on top, but actually it means so much more than that. So it's refurbishment, it's research, it's pieces of kit and equipment, and also we pay for some posts as well that wouldn't normally be able to be there to be supported. So we do lots of wonderful work, and we've been around for just over 10 years, and we've gone from strength to strength to strength to where we're in the position now where we're really seeing, because of the support of our community and everything that we've done previously, actually the impact that we've made over the last 10 years and the way that people are coming together really strongly now to support the people on the front line delivering services in this crisis.
Oh, brilliant. And do you just want to talk a little bit about the letter that you sent out, the one that I received?
Yeah, of course. So we, along with a number of hospital charities, obviously we were aware of the looming crisis and thinking about, well, what can we do now urgently, really, really, really quickly to get the message out that we need support for our NHS staff who's going to be working all the way through this. So we very quickly, in terms of campaign planning, completely off the table here. No months and months and months of strategic planning here. It was literally a couple of the team members proactively came to us as directors and said, look, there's an opportunity here that we really need to make the most of. So we quickly drew a campaign plan together with our individual giving, fundraising officer and comms manager, who really, created this campaign really, really quickly, where we then devised very quick key messages and had a very, very quick conversation with the trust in sense of our exec team to ensure that if we were to launch an appeal, will we be able to support that? Will we be able to know quite quickly what was needed? And also so we could spend the money, really. Right. So quickly putting those processes in place, which took about 5 days, and we launched so we had the conversation on the Monday, on the Friday we launched it. And in terms of your letter, that was part of an urgent reach out in terms of comms. So we decided to go firstly, just because it was quicker, on our website, putting out the message, we're looking to raise money here. We set up the fund, we're calling it the Staff Wellbeing Fund. We're looking to raise money to support the frontline staff, but also the staff throughout the hospital, because we can't forget that, the IT guys are working, the estates teams are working, the catering guys, the cleaners, everybody are trying to operate as normal to support them through this time. So what do they need? Okay, well, they need some food, and they're not going to have many breaks. Let's get refreshments to them. Let's ensure that they don't have to come off the wards for too long, that they can just keep supporting themselves.
So when you say off the wards, because obviously there's drinks facilities and catering facilities at office in hospitals already. So
Yes.
what do you mean by off the ward?
So at the moment, that's a really good question. So as a university hospital, we have 11,000 staff as they are operating normally, and we service quite about 3 million people throughout 9 counties. So we're we're like a little world in its own. So ordinarily we have a couple of coffee shops, we've got M&S, we've got WH Smith's, we've even got a mini M&S there as well, and there's also quite a big canteen for staff as well. Now sadly we've obviously had to shut all of that down,
Right.
because of health and safety prevention. So in terms of the staff actually getting what they need quickly has become even more of a challenge. Although one coffee shop is staying open with kind of shortened hours. This is Costa Coffee, who you're probably aware, they are supporting the NHS staff with free coffee at the moment. But they're very, very short on staff. And also we've got our feast, I call it our feast, it's our staff restaurant, which is still operating as well.
Okay.
But that's a real limited service. So what's happening is obviously staff are working around the clock, probably more than what they've ever had to before, and to ensure that they get what they need really, really quickly, we one of our 3 kind of key themes of our campaign is around rehydration. So that's making sure that they've got drinks, tea, coffee, soft drinks, real quick kind of healthy type snacks that they might be able to eat as and when they go by. Within the hospital setting themselves, some areas do have staff rooms, so we're able to facilitate all of that. We're calling them wellbeing packs at the moment. So we're able to facilitate getting packs into those staff rooms, but also a lot of areas, I'm sure everyone's experience that they have within hospitals is that there is a station there that we're looking to put refreshments and snacks there too. But part of that package as well is about meals as well. So we're looking to have we are having conversations at the moment with Feast, as I talked to you about, our staff restaurant, to look to see whether we can actually give out free meals to staff so they can get some nice hot meals as well.
Oh, excellent. So I know I've spoken to a lot of brands, and a lot of brands are saying that they are donating lots and lots of supplies. So hopefully, I'm not sure, have you found that any of these supplies has reached your hospitals?
Yeah, so we have. I mean, a lot of what's happened, our experience that we've had certainly in the last 5 days, it's been around shops who are actually locally, so shops who are closing because of obviously the virus and closing down. And so we've actually had donations from the likes of TK Maxx, but that's a local TK Maxx who had food in there that will go out of its sell by date. So it's kind of get it to us and we can distribute it out. So we've had donations from the local airport, so duty-free goods as well, so things that would have gone out of date under the kind of estimated time frame of this crisis. So,
but but you don't have any kind of regular donations feeding through?
Yeah, we've had, in terms of actual gifts in kind.
Actual, just like food products or
food products. So not regular. No, we've had, like I say, we've had that. We've also had a tea provider who's very kindly, he's one of our partners actually, Amid Tea. They've provided 36,000 tea bags to us as well, and they wanted to ensure that they did that before the lockdown happened so they could get them to us, because that's the challenge actually, is I think there probably would be more appetite there if the fact that actually logistically getting everything to site has become more and more of a challenge, as we know with deliveries as and when they are. But those have been sort of our biggest, and we've also, I mean, this isn't food related, but IKEA, for example, you know, they've closed locally in Southampton. We needed to kit out our safe space for staff. So this is a staff where an area where staff can come and just really sort of chill out and get any support that they might need in terms of psychological support as well. We're doing lots of virtual support at the moment, and we needed a space to do that. And IKEA have actually donated all the furniture.
Oh, brilliant. That's fantastic. But I know one of the big things that stood out to me around these hydration stations is that because we work with brands, and we know that brands work with lots and lots of sporting events, well, mostly sports, but lots of different events throughout the year. And it just seemed to me that this might be a really good opportunity for a brand to be able to step in, because I know there's so many behind the scenes that really want to help, but kind of aren't sure, and as well aren't sure how to face the NHS. It's such a huge beast. And right now, so many people are trying to make donations and do good and all the rest of it. But so how do you think this is something that brands can help with? And if so, do you think it's something that can be managed in a central way?
Yeah, absolutely. So I think from our perspective, as we are a hospital, and we're a hospital charity, we're very, very used to getting things done and getting things done really, really quickly, literally jumping on any opportunity that is provided to us. And certainly the hospital is hugely supportive of that, because as you can appreciate, anything that we can get to help support our staff and patients is something that we really want to prioritise. So in terms of the actual rehydration stations in themselves, we've been talking as well around not just kind of the need, meeting the need now, but using this as an opportunity of leaving a lasting legacy for the hospital, and actually a thank you for the staff for all of the hard work and determination and passion that they're putting in through this really challenging time. And something like a physical rehydration station, which is permanent, sort of whether that be where I've stated before, in the actual hospital department remit, ward, or whether it be within the staff rooms, is certainly something that I know that will be supported or look to be supported in terms of getting that done. I think the challenge for us will just be around kind of timeframes and logistically getting everything in. Just from the perspective that I've said before, it's quite a challenge getting deliveries in and orders and things like that. But I certainly believe that there will be support for that. And we've got so many people on the ground within the hospital at the moment working above and beyond to get things happening and get things happening really, really quickly. Right. But what I like about the idea of having a permanent rehydration station within the hospital, across the hospital, is that legacy piece. It's that kind of long term, well, thank you for what you're doing right now. You're amazing.
It is a really nice thank you. It is. Yeah. I mean, I've heard people say before, like, you know, after this is over, can you not just give nurses and medical staff free tea?
Yeah, exactly. So it's a real nice for now, but actually it's a long term. Oh my goodness, we were really, really valued. We were really appreciated, and we are continued to be valued, which is really, really important. So in terms of brands getting involved in this, I suppose what I will say is that we can immobilise things really, really quickly if the support is there and the support is committed. Because I think that's the thing, is that if it's a kind of, oh, maybe we're not quite sure. Well, actually, if somebody says to us, well, absolutely, we're committed to support you on this, then I can then look to facilitate that within the hospital. And I'm sure other hospital fundraisers will hopefully say, you know, exactly the same thing, because that's what we do as fundraisers generally, you know, jump on any opportunity that's given. In terms of, I suppose, going back a bit, you know, we appreciate that in terms of brand and marketing spend, that it's really, really vital that we do monitor the impact and the legacy that will have. Certainly from my experience before I came down to Southampton, I specialised in corporate fundraising. So I worked for the British Heart Foundation, Breast Cancer Care, so quite large charities, where my job really was to work with big organisations who were contributing significantly, multi-million pounds in support of the cause. So whether it be cause-related marketing, whether it be sponsorship, that was kind of my area of expertise. So part of that was proposing what that difference will make for the provider. So for example, if it was a sponsorship of an event, like when I was at the British Heart Foundation, they've got a big event called the London to Brighton Bike Ride. My job was to get a 3-year sponsor for that, multi-million pound sponsor. Actually, no, that was a lie. It wasn't multi-million pounds. It was 300,000. Sorry, it seems like a long time ago. But part of that was putting together a proposal around what will be received in terms of the impact. So, you know, what branding can we produce, where will the branding be, how we promote the partnership, where we would put the partnership in terms of like logo, website, social media and all that kind of thing. Actually ironing out what our reach is in terms of communication, you know, so what we have through our own mechanisms that we reach out to people. Certainly within the hospital charity, we are a kind of a smaller clog, I suppose, in the big wheel of the hospital. But as I say, you have to remember, we are a university hospital, a specialist centre of excellence within this country. So we have respect throughout the UK and indeed nationally as well. So from my experience, I will be able to pull together what is needed in terms of brands and companies to be able to identify the impact that they will have in terms of their marketing and their reach. And that's something that we will be able to do. In terms of the hospital itself, we do have a commercial team as well. So they look and they support the partners that the hospital have commercially. As you can appreciate, NHS, we are a hospital, so we're really trying to look all the time to see how we can make money to keep feeding it back into the hospital to make it a better place for patients. Okay. And part of that is how we gather more income commercially. So we've got a commercial team there as well, who I know will help to kind of support getting all the information together, so brands are aware of, okay, so right, you're telling me this is what you need, this is how much it's going to cost, and this is what we will receive in response to our donation.
Oh, that is brilliant. And I think it's really nice to know that that's something that you can pick up and manage for a brand, because as I said, it's you know, they're used to buying media, they're used to sponsorship, and the NHS can seem like a big unknown kind of beast that they've not worked with before.
Yeah.
And I really hope, and I just really want to thank you for coming on today and having a chat with me, and that I'm hoping somebody will watch the video and reach out to you, Jeneen, and you get the much needed funds that you need to have a legacy go on, because I think we all understand that charities at the moment, there's a huge hole, you know, as the country isn't earning any money. All of the events, the sporting events, the things that help raise money for the charities have all been cancelled. And so we're now looking to brands who, you know, we're spending a lot of money with during this lockdown to leave a legacy behind, to say we were here. And a lot of them are doing it, and I applaud all of them, because quite a few have been in touch with me to say exactly what they're doing.
Absolutely.
And all of us out here really, really appreciate it. But if you can do more, and if you do think, you know, supporting hospitals with hydration stations so that the nursing and medical teams can have coffees and teas and snacks and things they need close by to them for free, because I know in my office we provide tea and coffee for free, then yes, please do get in touch with Jeneen or myself, and we can open up the conversation. So thanks, Jeneen.
Thank you.
Good luck.
Thank you very much. Thank you.